to be alive. And as we come today, education is the passport to take to the future, for tomorrow belongs to those who prepare for it today. I welcome you all to this, our first collaboration with the Sigma Theta Tau. And I do believe that we are going to have a beautiful evening. We are going to be enriched. We are going to be educated. We are going to gain knowledge. And as Cheryl said, grab a friend, call somebody and tell them that this is the place to be at this point in time, at this hour. Let's get into it. Welcome, welcome, welcome.
Thank you so much, Madam President. I agree with you. We will be having a good talk this afternoon. So just before our program gets started, because I will share with you our program for today, I'm going to be calling on Mrs. Verona Henry Ferguson. Madam Verona, are you here with us? To just open in prayer for us. Verona, are you here with us?
Yes, good afternoon. Good afternoon, colleagues. Permit me praying without opening my camera. Let us pray. Our kind Father, Jehovah, we humbly approach you through the name of your Son, Christ Jesus. We want to give you thanks for sparing our lives and for giving us this opportunity where we can come together as professional nurses to talk about research, Jehovah, because we know that we need the evidence to inform all that we do nursing. And Jehovah, this is an initiative that has been long overdue, where we are collaborating as nurses across Jamaica for nursing research. We pray that all that we do today will be done to your honor and to your glory. We pray that the conversations will be fruitful and that at the end of it, we will leave with a sense of direction that we need to take us to the next level, Jehovah. And I pray that the persons who will be presenting and the persons who are moderating, you will give them clarity of thought, that they will express their ideas in ways that can rally the troops and allow us to see a clear path forward. We're going to leave this meeting in your charge, and we pray that your Holy Spirit will guide us through to the end. These are the things we ask, and all of the things that we fail to ask, please grant them unto us as you see fit. These are our thoughts at this time. Amen.
Amen. Thank you so much, Mrs. Henry Ferguson. Thank you so much. All right, colleagues. So for those who are joining us late, welcome again. And for the other persons who are coming, you may be able to tell them in the chat, but we'll say it periodically. My name is Cheryl Garrick-Lloyd, and I'm president of the Omega Kappa chapter of Sigma. And with me, walking you and talking you through this session this afternoon will be Mrs. Patsy Edwards Henry, president of the Nurses Association of Jamaica. We have a cross-section of persons joining us, so it's not just for Jamaica, but for our region. And we want to take you through this afternoon's program. So let us start off. I will share the items from the program momentarily in the chat, but let me just tell you, today we're going to be talking about an historical perspective of what nursing research has looked like in the Caribbean to date. We are going to hear from two nurses who are teaching, and so they will give us the nursing educators' perspective on nursing research. And then we have two more of our colleagues who will be talking us about their perspective as nurses who are involved with research. And then we have another lovely colleague who will be taking us through nursing research in action. She has been quite busy. And then just before we have the question and answer section, we'll be hearing from the research chair for both Omega Kappa and the Nurses Association of Jamaica, what do we want to see happening coming up? And then we'll give everybody who's here an opportunity, if you'd so like, to ask your questions and your answers. I'm sure all of us are aware that sometimes our introduction to research leaves us as nurses not so interested in research. So think about your questions. Remember to keep your microphones muted. And when we're at the Q&A section, you'll be able to type them in the chat or raise your hands, and we can have a robust conversation. And we'll close out our session with asking all our presenters to just give us a few recommendations on how can we move nursing research forward. And so, without further ado, let me introduce to you our presenter who will be taking us through a historical perspective of nursing research in the Caribbean. This will be done by Professor Eulalia Kawa. Professor Kawa is the Graduate Program Coordinator and the Deputy Director of the World Health Organization's Collaborating Center for Nursing and Midwifery Development in the Caribbean, and this is at the UWI School of Nursing, Mona. She was also the Country Program Director of the 5-year Program of Research on Strengthening Nurses' Capacity in Research and HIV Policy Development in Sub-Saharan Africa and the Caribbean. This was a collaboration between Canada, Jamaica, Kenya, Uganda, and South Africa, funded by the International Development Research Center in Canada. From this experience, a program of research internship was developed, an international program for health researchers at the UWI School of Nursing, Mona, in 2013. The main aim of that research internship was to build research capacity among nurses and other healthcare workers. Prof. Kawa has also played a key role in the designation of the UWI School of Nursing, Mona, and the University Hospital of the West Indies as best practice spotlight organizations to build capacity for evidence-based nursing practice. And we welcome you, Prof. Kawa. If we could open our mics and clap, we would, but we welcome you, Professor Eulalia Kawa.
Thank you so much, Madam President. Thank you for the opportunity to share the historical perspective where we are in research. So I am going to share my screen. Okay, share. All right, so I'm going to be looking at the nursing and midwifery research in the Caribbean. And how do I move to the next slide? Okay, I'm not, oh, okay, I see. All right, so in terms of the historical perspective, nursing research came to the forefront when Dr. Mary J. Seabright took over as the first Jamaican to lead the then Advanced Nursing Education Unit. That was in 1971. So she championed the review of the curriculum at that time to include a research methods course to ensure that nurses develop skills and competence in research. Of course, this this emphasis was really UWISON has really made sure that this legacy continued, because although there were BSN programs, UWISON began postgraduate training at the master's level that was in 2002, and of course the MPhil PhD level in 2012. So that really, the training is what, the focus is to develop skills at the higher level to be able to ensure that nurses do research. But we, as a collaborating center in our last designation, one of our activities was to look at, to assess the status of nursing and midwifery research in the Caribbean. So the UWISON team collaborated with the University of North Carolina at Chapel Hill School of Nursing team. We conducted a bibliometric analysis to determine research output level, the research focus, collaboration networks, and visibility of nursing and midwifery research in the Caribbean during the period 2000 to 2020. Bibliometric indicators provide information on research patterns of individual researchers, countries, and institutions. They also provide information on the quantity and the quality of published research. So it is a methodology that is used when, in assessing the level of nursing research and the visibility of nursing research. And it also helps to identify gaps in research. So that expertise, that is what the expertise that the University of North Carolina had, and we had, the two librarians who worked with us to do, to do this analysis. So we searched the Scopus database and to identify publications by nurses and midwives in the Caribbean, as I said, during the period 2000 to 2020. We analyzed all publications providing affiliation data indicating a Caribbean geographic location, nurse or midwife term incorporated in the organization name or author's credentials. All publication types and languages were included in the analysis. We used the full counting method to determine the number of publications, and also we did organizational analysis and collaboration networks, which was determined using the VOS view application, which is a method that is used. So in terms of summary of results, so this graph shows the nursing research from the year 2000 to now, which is 2020. So during the year 2000, the number of publications have been rising from 22. Right now, what we found was about 584 articles based on the research, on the search methods that we used. So this is, as you can see, it has been climbing from, of course, we began from 2000. So you can see a steady growth in terms of nursing research in the Caribbean. This graph shows, looks at, blue is the cumulative nursing research publications globally, and the orange is where where we are in the Caribbean. So we are, although we are having a steady growth, we are still below the global, the level that is nursing research is on globally. On this slide, we are looking at, we looked at the publications from different countries. And as you can see, Cuba had the highest number of publications. Based during that period, there were about 318 out of the 543, I think, publications that we identified, 534, 300 and okay, it's over 300. So they had the highest number of publications, followed by Jamaica, Puerto Rico, and all these other countries that you can see. Some countries such as St. Lucia, Martinique, Dominica, Cayman Islands, Antigua and Barbuda had the lowest number of publications. But again, you have to keep in mind the kind of criteria that we use to search. This looks at Caribbean institutions with the most publications. These are about the 10 institutions that had the most publications. The highest was University of the West Indies, Jamaica, followed by Puerto Rico, and most of others were Cuba, and we have Trinidad and Tobago, the St. Augustine campus, and that is the number of publications from the different institutions. This figure looks at the type of publications, and as you can see, the reviewed, peer-reviewed articles were the highest, 83.6% were peer-reviewed articles, and others were like review articles, which were about 9%, and others at the lowest level, like book chapters, were 0.68%, and short surveys were about 0.34%. This figure looks at the collaboration networks. This is just one I'm just summarizing, in terms of the areas that we looked at. As you can see, most Caribbean countries really collaborated with Canada, United States, and of course there are some collaborations within between Caribbean countries, Jamaica collaborating with Barbados, and Trinidad and Tobago. So the colors indicate in terms of recency. One thing you would observe from this, Cuba started their collaboration, their networks longer than we saw ours. In the Caribbean, other Caribbean countries are most recent, between 2012, 2013, that's when those collaborations began. But Cuba started, some time ago compared to other Caribbean countries. And one other thing that you would observe, they really collaborate mainly with Spanish speaking, with other Spanish speaking countries, mainly. Just only countries such as, India, and some collaborations with Italy and Belgium and Philippines. But on the most part, they collaborate with other Spanish speaking countries, of course, and we understand because of the language issue. Other key findings, in terms of the visibility of nursing research, 6 out of the 14 high-ranked journals which published majority of research articles authored by nurse researchers in the Caribbean were Cuban articles, journals, mainly because most of the articles, the research was from Cuba. So the journals that were really ranked high, I did not put up that table because it is very long. So most of those were Cuban journals. However, those 6 journals did not have an impact factor, and they had a very low site score ranging between 0.1 and 0.5. Only a small proportion, which was 21.8% of articles published by nurse researchers in the Caribbean, were published in top-ranked journals with an impact factor which ranged between 0.098 and 2.034. And in fact, that journal is the International Nursing Review, which had the highest impact factor. Okay, the strengths of this, study were really the fact that we used Scopus is one of the leading databases of journal coverage and scholarly impact. Nursing publications really, and scholarly impact is well represented in Scopus. However, some publications authored by nursing and midwifery researchers in the Caribbean may have been published in journals that are not indexed in Scopus. As we know, for example, our own journal, the Caribbean Journal of Nursing, is not indexed. So those articles that would have been published in that journal or any other journal that is not indexed in Scopus, we would not have been included in the analysis. The other limitation is that the lack of graduate programs in nursing in the Caribbean resulted in a limited number of nurses who pursued graduate studies locally, enrolling in graduate programs in other disciplines such as psychology, education, epidemiology, public health. So you'll find that although they are nurses and they are doing research, because of the key terms that were used in searching, those would have been excluded. For example, for example, I mean, my own research on asthma, because it does not include the word in nursing midwifery, would have included. And of course, as we know, others, even on the panel, would have done some other studies that really don't include, they are not really, the research is not in focusing on nursing as such. So those, if they, the use of such terms, nurse or midwife, incorporated into the organizational name or credentials of authors may have excluded some articles authored by nurse researchers not focusing on nursing or midwifery. And there are some journals which don't even include the researchers' credentials. So conclusion, I'm only presenting just a few findings. Bibliometric indicators in this analysis suggest low but recent and steady growth in nursing and midwifery research in the Caribbean. As we saw this slide, that graph, which is showing how we have been doing from 2000 up to now. Most of the publications were from Caribbean countries with doctoral level nursing programs. Now, this is very important because Cuba started the, nursing graduate programs, a long time ago, and they have a number of programs as compared to us. I mean, in the Caribbean, right now we don't have many, PhD programs. We only have one at UWISON, which is only started in the academic year 2012, 2013. So equipping nurses and midwives with the necessary knowledge and skills to lead, teach, and conduct high quality research through doctoral level education is an imperative for increasing nursing research productivity among Caribbean nurses and midwives. And this is because when you look at, there is literature from Latin America countries. Brazil has the highest number of PhD programs, and those programs started over 20 years ago, and they have the highest number of publications by nurses and midwives. So it is really important having nurses prepared at the doctoral level is really key to advancing nursing research. And I will end there. The article has been submitted for publication. It is under review, so hopefully it will be published. Thank you.
Thank you so much, Prof. Kawa. Thank you so much for walking us from to where we are. And I will tell you, as I was listening, while we are working on sessions like these to increase and develop and build our capacity, as our flyer was saying, we are happy with slow. We're hoping that slow will get faster and that steady is good. So it means that at least we are moving along. So thank you so much, Prof. Kawa, for giving us that highlight. And so next we're gonna be having two perspectives given to us. We will have, I'm sure Dr. Ocho would say ladies before gentlemen. So we're gonna be hearing about the nurse educator's perspective on nursing research. We will have two persons who are teaching research share with us what their perspectives are on teaching. So let me tell you who both of them are. We will start with Mrs. Diana Parsons McIntyre. And Mrs. Parsons McIntyre has been a registered nurse for over 26 years. She's also a registered midwife and a pediatric nurse. She completed her Master of Science in Nursing Education, and she presently works as an educator at the Ministry of Health and Wellness's In-Service Education Unit. She has been there for the past 15 years, and she also lectures part-time at University of Technology / Kingston Public Hospital Schools of Anesthesia in the Critical Care Program. She is the coordinator for the Pediatric Nursing Program, the venipuncture program, and she's the main lecturer of the research methodology at the In-Service Education Unit. Just after Mrs. McIntyre, we will have Dr. Ocho. Dr. Oscar Noel Ocho currently serves as the director at the UWI School of Nursing at the St. Augustine campus in Trinidad and Tobago. He's also the director of the PAHO WHO Collaborating Center for Nursing and Midwifery, looking at leadership and policy. Dr. Ocho was a public servant for over 30 years prior to joining the faculty at UWI, and his qualifications includes his BSc in nursing, in focusing on education. He has a Master's of Public Health in International Health, a MPhil in Sociology, and a doctorate in Public Health. Dr. Ocho is also a Population Leadership Fellow at the University of Washington and a Caribbean Health Leadership Institute Scholar. So we'll have Mrs. Parsons McIntyre and then Dr. Oscar Ocho. Mrs. McIntyre, over to you.
Okay, good evening, everyone. Let me say a very big thank you to Mrs. Chisholm Ford and her team for inviting me to share in this presentation. And indeed, you know, talking about research for me personally is quite exciting. You know, and the students will often ask me what is so exciting about research. I mean, research for some would appear or seem to be quite boring and just nothing that would stimulate. But that is why we are here as educators, you know, just to share our perspective and to see how best we can advance, promote, and facilitate research so that all of us, even here on this platform, I would want to think that the fact that you are here, you know, you too are excited about research. And so you are here to share with us. Now, why is research so relevant? We recognize that it is because teaching will improve if the staff engage in research, right? So we have what is known as research-based teaching. Students will learn more if they come into contact or in contact with research. And so we have what is known as research-based learning. The professional practice will improve if professional workers in their training learn how to base their work on research-based knowledge. And so we have research-based practice. And the professional programs have an obligation to improve the knowledge base of professional work through research. And we have what is known as research-based knowledge production. So yes, everybody, good evening. This is why we do research, why it is that we want to promote, facilitate, and advance research. So in our promotion, we make it a very important part of nursing education at the Ministry of Health and Service Education Unit. And so research is now added to all 8 programs that we offer at the school. So initially, it was conducted only by the students who were pursuing nursing administration and the psychiatric nursing, programs. And in 2019, we looked at it. When we started our new programs, we had added to our program the nephrology nursing, emergency nursing, operating theater. And so when we started those curriculum, those programs at this institution, we decided that research had to be a part of the curriculum. And then we ensured that we pushed it a little further. And so it is in the pediatric, the nephrology, the neonatology, the oncology, right? And of course, I had said it was a part of nursing admin and psychiatric nursing. So it is now a part of every program. So anybody who is coming to in service now know that they have to conduct research. Fortunately or unfortunately, it is a group research. And so I believe that it makes it a little bit easier for the students as they try, to get a better grasp of it. And so what we now do is initially it would have been in an area of maybe sociology or maybe psychology or even psychiatric nursing, but it is now based on the specialty. So if the students are doing pediatric nursing, then the research is based on a pediatric field, a pediatric area, you know, whether it's a condition, whether it's the parents, the children, same thing as it relates to neonatology, oncology, emergency. So we ensure that if you're coming in to this area, you're going to be studying this specialty, your research is based on that. And we recognize that a lot of our students who come in to us from, of course, you know, it would have started from the generic program, that they have a block to research. And you know, so when we start off with teaching research, of course, from the interview stage, you know, you say to students, come with a topic. You are going to be conducting research. What is it that you've heard about the program, or you know, the first thing they say is that you have to do a research, and you see everybody make up their face, and you see the faces drop, and nobody seemed to be interested or excited. But we realize that a lot of it, you know, would have stemmed from the fact that the students may not have felt that, maybe, as you recognize that in our generic programs, they are so large. And so for a research educator to be trying to teach research to so many students, trying to reach them, you know, at once, and to get get a feel of what it is the students appreciate or are not very clear about research, it is difficult. And even though our group is much smaller, classes are much smaller, you know, than it would be for the generic, it still is challenging for us to teach. But we make the effort. You know, we divide the students into smaller groups based on our faculty members, and we work along with the students to get them to understand and to appreciate research even more. Now, I do believe, because of the fact that we have to seek permission to conduct research through the regional health authorities, University of the West Indies, Ministry of Health and Wellness, Ministry of Education, National Security, religious organizations, and even our non-governmental organizations, that people are now more aware that nurses are part of evidence-based practice. So if they didn't know before, you know, like especially these other organizations outside of health, they never knew before that as nurses, research is important. When they see us seeking permission, when they see the nurses coming in to their facilities, they recognize that it is quite important. And so they too buy into it. And this is what makes the students even more excited about conducting the research. So we are part of promoting it. We host our own research conferences. We join also, as we know, in regional and international areas. And we also, when I put, as it relates to, you know, we want to be recognized. And I believe that's part of our promotion. We want to be recognized. Our research, at once we were invited to go to Dubai, but nobody bought into it because they didn't feel that nurses are part of research, and that nurses are important in conducting research. We want to have changed. We facilitate by making teaching and learning of research fun. The facilitator work along, we sell it, we make it a necessary part of the profession. We provide leadership and supervision. We advance it by ensuring the students are learning research at every level. And so that's what we do as educators, from the generic level, the post-basic level, the master's and the PhD level. It has to be a part of every program for nursing research to advance. We have seen research in our Jamaican Nurse NAJ magazine. It has to continue. We have to make sure people are published. We do so many innovative things in our institutions, but yet we don't document them. We don't carry out studies. We don't seek sponsorship, right? If we look at what happened with our papa and pressure ulcers, I don't have time to go into it, but we know that someone almost stole it from us. And because Dr. Hermie Hewitt took it back and pushed for it, we were able to call it a Jamaican research. And so we see research as being very, very important as educators. So the ultimate intent of knowledge generated through research is to provide information for guiding our nursing practice, assessing the healthcare environment, enhancing our patient, our family, and community outcomes, and for shaping health policies. That's why research is important for us as educators. So to do successful research, you don't need to know everything. You just need to know of one thing that isn't known. Author Shalom. All right, thank you so much.
Thank you so much, Mrs. Parsons McIntyre. Over to you, Dr. Ocho.
Thank you so much. And if the host can allow me to share my screen, I'll be.
You're able to go right ahead.
Okay, lovely, great. So thank you so much for inviting me to be part of this forum. Yes, let me make sure that I have it up. And I just have 7 points that I want to put on the table for consideration. And while my colleague took the perspective of the student, I am going to take the perspective of the educator. And what I want to put on the table as someone who teaches research both at the undergraduate and the graduate level is that there is an underlying assumption that nurse educators who teach and supervise research understand research. In my own experience, and even going to conferences in the region and beyond, very often I myself am so amazed at how some educators lack the basic knowledge of the research process, but sometimes become so hypersensitive. But I also have come to recognize that there are lots of people who do not wish to become supervisors of students' research simply because they themselves do not feel as though they have the requisite level of competence and knowledge of the research process. The other critical thing which I want to put on the table is that nurse educators must recognize that academic writing, which allows for esoteric and poetic expressions, is different from research writing, which requires analytical thought that is rooted in information literacy. And this is a fundamental point, which I think a lot of nurses in the region struggle with, because we are so used, because we operate within the oral tradition, where we like to express ourselves. So we find ourselves sometimes, even in our writing, making very outlandish and esoteric statements. And the question is, where is the evidence to support what you wish to say? It is absent, but we are so comfortable because it sounds nice, it reads well. From a linguistic perspective, it's correct. But from a research perspective, if it's not supported by our ability not only to search out the literature, but for us to be able to understand, collate, and repackage the information within the context of the variables of interest, we sometimes may find ourselves guiding students in writing things that sound nice, but it doesn't fit within the rudiments of research writing. Now, the third point, which builds on that point, is nurse educators must understand the research process if they're to guide students effectively. And it is something that I see very, very often. So take, for example, one of the big areas of confusion for a lot of researchers and even persons who are guiding students is, what is the difference between a conceptual and a theoretical framework? And sometimes the students could do a complete literature review, and sometimes they present an annotated bibliography, and we feel so good because the student has done a literature review. But that's an annotated bibliography which summarizes each article, but they are not linked to any variables. And therefore, if we don't understand how to guide students in developing their conceptual framework, which then would form the basis to guide the entire research process, from your objectives to your research questions to your outcomes, which will also guide your literature review and your methodology, we would find our students writing a whole lot. And at the end of writing, they don't know where they're going. Now, I had an extremely rich experience as the lead supervisor for an MPhil PhD student who is not a nurse, nor is in the Faculty of Medical Sciences. And I remember when Graduate Studies sent me the request, I felt so pain for the student, because after writing 163 pages and submitting it to myself and her two supervisors who were from her faculty, I had to say to the student, I'm sorry, you have to start all over. It was a painful thing, but we were able to get that young lady to the point where when she presented at the first seminar, she said to us, I now see what you were asking me. I didn't think I could do it, but the directions that I've gotten are very clear. The fourth point I want to make is a particularly distressing one, because seeking ethical approval can be extremely exhausting, which is exhausting both for the academic as well as the student, because some academic boards are very picky. Some are just concerned about English, and it's not so much about the quality of the study. The other challenge is which I wish to raise, which is my fifth point. For many nurse educators, participating in research activities is usually an academic exercise. So I have found and I've realized, and it's something that maybe we need to examine from a research project perspective. There are so many nurses, and even though Prof. Kawa presented her findings, the reality is there are many people who have completed so many academic programs from the undergraduate right up to the graduate program, and do not have one academic paper that has been produced and published in a peer-reviewed journal. In fact, I have heard many educators say, look, you see me, I just want to finish this and done. The sixth point is very important, and it's something that I have been working with my students and saying to them, every research project that you do must be translated into publication. And if only we start investing then in providing quality academic supervision to our students, then it means that at the end of the exercise, because the methodology would have been robust enough, then we can be able to translate those findings into high quality journals. And the final point I wish to make is born out of my own experience. as a young student, as well as myself now as an educator providing guidance to students. Guiding young researchers requires supervisors who are sensitive and supportive, and students who are humble and not hypersensitive. And I wanted to end with this particular point, because if I go back to my very introduction to research, I was extremely nauseated by my own experience. I remember when we had to present our projects, before the final project, there was one student in my cohort who got all the accolades and praises because that student was supported by the lecturer. Every last one of us were made to feel less than the white line. And that experience was at my alma mater, UWISON, Jamaica. It was excruciatingly painful. But you know what was interesting? At the end of our projects, the ones who were trampled upon were the ones who prevailed. You know why? We dusted ourselves and we got down to prove that we were not daft. And the one who was applauded, her presentation at the end of the project was atrocious. But on the other hand, I have seen it often, even with my participation at the research conference at UWISON. I know even staff sometimes are upset with my interventions and interjections. I am painfully aware of it, but I'm also painfully aware of the fact, and gladly so, that many people were extremely glad for those interventions because it helped to create light in a dark place. So students have to recognize that when we provide critique, it is not to make them feel as though they cannot achieve or they do not understand, but it's for us to help them to recognize that we have passed this way and our role is to support you. Thank you.
Thank you so much, Dr. Ocho. Sounds like you touched a few nerves. So I want to thank you and Mrs. Parsons McIntyre. I've listened. Research is important. It's important for those who are teaching to be involved in research. It's important for the students to be involved in research. And it's important that we find that balance between the supervisor and the student, and to ensure we're working on getting it published, we need to send the information out. So just before I hand over to Mrs. Edwards Henry, I just want to launch a quick poll, and while you are answering, I will just share a few things. Please be reminded that we are giving continuing education certificate for this session. The registration link is in the chat if persons saw the link and joined without registering, because registration allows us to have your correct name and your email address so that the certificates can be correct and be sent out to you. We're also asking persons who are here, please double check and rename yourself. See, ours can be given to a DL3, a Samsung Z, a Amcheck so-and-so, or a S Brown, or a Thompson only. We need to have full names, correct names as they should be on your certificate. Thank you so much, because we'll be checking the attendance with the registration to generate the certificates. All right, so I'm just giving a few more people the opportunity to respond. Are you interested in doing nursing research? Yes, no, or maybe so. All right, about 5 more seconds and let's see. All right, perfect. Now let's share the results. We have 67% of the persons who participated saying yes, they are interested. 7% said no, and 26% said maybe. We're hoping to convince the no's and the maybes, but look out for the other question coming up. And so we will move into the other section of our program, where we will hear about the nursing research perspective from the nurse researchers and nursing research in action. Over to you, Mrs. Edwards-Henry.
Thank you very much, President Cheryl Garrett Lloyd. And I'm sure we're having a good feast this evening. Thanks so far to Prof. Kawa. She was my research supervisor and I enjoyed. And you know, the two perspectives that we got relating to the teacher and the student, I'm excited to go. And as we move forward, we will now be hearing from our researchers themselves. So we have two beautiful ladies with us this afternoon. I will introduce both and they will take it away. So Mrs. Denise McFarland is the health specialist in the population and health unit of the social policy planning and research division at the Planning Institute of Jamaica. She holds a certificate in nursing, a bachelor's of science degree in education, a master's of science degree in epidemiology, and is currently pursuing a doctoral degree in public health. Mrs. McFarland's professional contribution to the healthcare services has spanned over 19 years, and her input to national development at the PIOJ spans over 4 years and involves leadership roles. She is involved in monitoring and coordinating of national policies and programs. So we'll put our hands together and welcome Mrs. McFarland, and we'll also welcome Mrs. Duncan Baker. Mrs. Tamika Duncan Baker has been a nurse for over 22 years. She holds certificates and degrees in general nursing, midwifery, public health nursing, family nurse practitioner, and clinical research professional. She has been employed at the University of the West Indies in the Faculty of Medical Sciences since 2007 as a research nurse. She is a member of several professional bodies, including the Association of Clinical Research Professionals, Sigma Theta Tau International Honor Society of Nursing, the Omega Kappa Chapter, Go Okers, and the Nurses Association of Jamaica. Ladies and gentlemen, let us put our hands together and welcome these two ladies as we continue our feast on the importance of research in nursing. Mrs. McFarland, take it away.
Thank you, Madam President and colleague, Mrs. Patsy Edwards-Henry, and good afternoon to all my colleagues. As I present here the, looking at policy research. I rather enjoyed all the presentations prior to now, and I wanted to give a little overview of what is a different perspective when we look at research in the policy setting. And in particular, I will give you the perspective from the Planning Institute of Jamaica. So policy research really is just a process of conducting research or analysis of a fundamental social problem. So we know that health is a social problem. So I'm in the Department of Social Policy Planning and Research. And in this division, we have education, social protection, security, labor market, health. So health is a social problem, it's a social issue. We have not in so much as really narrowed in on viewing for example, the community approach to health, for example, health in social protection, health among people who are poor. Does poverty contribute to your health outcome? Health in terms of the economy. There's a section I write in one of the publication on the percentage, the total health expenditure as a percentage of the general of the GDP. Do we look at health in that perspective? So it's more than just the perspective of nursing and nursing care, but we also have to be able to look at health in the broader realm of sustainable development. If we don't do that, then we will find ourselves going backward rather than forward. And a lot of us have a large experience with the Sustainable Development Goals, which are anchored here in the Planning Institute of Jamaica as well. We presented our first voluntary national report, and goal 3, which is the health goal that I was very instrumental in putting together what Jamaica's perspective on health in general, which of course includes nursing. So we are a very large and a very important part of the whole health landscape. So in the policy research, I'll take you through a couple of documents that we write here that includes health and would include nursing. The first one is the Economic and Social Survey of Jamaica. And you would have seen this publication. I'm sure a lot of you would have seen this publication on a lot of occasions. It has a very wide plethora of data and information included in this. And included in this volume is a health chapter as well. But it looks at Jamaica's economy and how it continues to progress and grow. When we hear about the 1.2% or the 1% growth in our economy, they also take into consideration the health indicators. And some of those we look at are immunization rates, the proportion of persons with NCDs, for example, the proportion of persons now with COVID-19. So health is wealth, and we connected to our national vision. Some of you know Vision 2030 Jamaica National Development Plan. And we are outcome 1, where we look at a healthy and stable population. So all the research that you are doing in your schools of nursing, in your university, in your individual presentations, as the landscape as described by Professor Kawa, all of that comes together to look at health holistically. And so we see whether or not we have a healthy and stable population. So health is wealth. So the entire chapter of in the Economic and Social Survey of Jamaica on health really pulls together all those different arms of health. We look at our morbidity, mortality, you look at what our life expectancy is, you look at the major programs and plans that are put in place, which includes nursing. This year, a major part of what I included was the International Year of the Nurse. And it would include all our achievements under nursing that we report on in the Economic and Social Survey of Jamaica. In that publication as well, you have the chapter on our official development assistance. That's all the monies that are coming in from the different international development partners, which includes the UN, the World Banks, the Inter-American Development Banks, you name it. They are all in there, and their contributions to health is also counted and reflected. Policy research as well. It's an area for you to feed up your research from the level you are up into the policy level, because it also gives a direct report on strategies and policies that are developed throughout the country. And I'll move quickly. I could spend a whole evening telling you about that, but we can look at the Jamaica Survey of Living Conditions. This is another premier publication from the Planning Institute of Jamaica. This is what it looks like. The health chapter is also written by myself, but this is a survey which is done yearly. It's a representative proportion of the population. So when we speak of the data and results from the Economic and Social Survey of Jamaica, from the Jamaica Survey of Living Conditions, sorry. When we speak of that data, we speak of Jamaica in total. Jamaica is this, Jamaica is that, because the sample is representative of the population. It is done, it's a household survey, but the sample is done by Statin, and also the data collection is done by Statin. So the health chapter would give you data broken down according to several different classifications. We go according to age, geographical location, as well as or your social status, quintiles we call it, quintile 1 to 5, from the poorest to the richest, or from the richest to the poorest. I also had some other areas that I wanted to tell you about the Essential National Health Research. Some of us are also members of the Essential National Health Research committee, but we have put together through the Ministry of Health a list of priority areas where the priority research that is to be done in the island with regards to health is written. Now, you might say, boy, this is not important. It is important because there are scholarships that are given through this Essential National Health Research program with the Ministry of Health. So if your nursing research is geared towards one of these specific areas, then you can apply for a grant from the Ministry of Health. And this too is it's very important in terms of those persons who are doing PhD studies, that if your study is under one of the 10 areas from that list of essential national health research areas, then you could also get funding for your area of study. And the next one I want to look at is the National COVID-19 Research Roadmap. Now, this was recently developed, but was at the beginning of COVID, the Ministry of Health approached the Planning Institute of Jamaica, and, you know, through the ENHRC, I said, boy, we really want to look at some research in action. So can we do some research while COVID is going on so we can help the policy decisions on this side? And so there are several, it's an entire roadmap looking at several different areas of the COVID-19. It looks at the clinical, it looks at the social, it looks at the community side, it looks at health systems. And on the health systems, there is one of the larger projects that came out of that, one of the research projects. It's a mixed method project that will be running through my desk, looking at the multi-sectoral approach to the COVID-19 response. So you're actually looking now at an assessment of the health in all approach. This is something you would have heard that came out of PAHO. What is a health in all approach? And how can that be applied to the COVID-19 situation, and even through the COVID-19, can it be applied afterwards? And so I had put a draft of what that project is like there. I want to show you some of our major data sources, which I think is very important to other people, as well as your research. You can look at the Hospital Monthly Statistical Report. These are large databases that are embedded in the Ministry of Health that you can actually have access to as you do your research. The MRCA, CMHR, Community Mental Health Report, Medical Records Case Abstract, Monthly Clinical Summary Report from the Ministry of Health, the Expanded Program on Immunization. There's a whole immunization database there as well. And the injury surveillance. HIV, AIDS has a really big database system within the Ministry of Health. If you're looking at studies in that area, the maternal mortality, which is which is on the Essential National Health Research list, and is also on the Sustainable Development Goal under Goal 3. And of course, we have the communicable diseases as well, that database under their surveillance. This is one of the table, what one of the table looks like from the Economic and Social Survey of Jamaica. I wanted to show you like some of the data that we actually have coming out of this publication. We can look at casualty attendees, average bed complement in the island. You can look at the admissions. We have the bed occupancy per year, whether we are 75.9, 75.1, 81.7%. Occupancy rate. The length of stay across the island is also in it. The amount of number of operations, total births, and so on. That is some of the data that we keep a track on in the Economic and Social Survey of Jamaica. And for the Jamaica Survey of Living Conditions, I wanted to show you some of the disaggregations that we have as well. Region. So you can do your, and this database resides at the University of the West Indies. So you can actually have access to it. But the disaggregation is cut into regions, urban centers, rural areas, and Kingston. And this is a quintile disaggregation according to sex and according to age breakdown. So it's all there. This one is literally looking at, let's look at this column where we're reporting illnesses and injury in the country. So for the year, about 10%, no, sorry, this is about 7%. About 7% of the population reported some kind of illnesses for the year. And of that number that reported being ill, 7%, another 7.5% of that, sorry, then the mean days of illness, right? So 7% illnesses have been ill, and then the mean days of illness and injury. Persons are sick maybe for about 7-8 days, the most, and 65% of them who were sick, they sought medical care, and 92% purchased medication. So we can see that the medication access is very, very high for those persons who have been sick. But of those who are sick, only 65% of them sought medical care. So, I mean, that can be improved as well if you're talking about health outcomes. So what is the importance of policy research? What do we do with what we get in here? You look at high-end policy outcome. It drives changes within the Ministry of Health and nationally. So from our looking at the pharmacy numbers, we've been able to, the NHF has been able to expand their VEN list. And the highlighting of the morbidity and mortality rates, especially maternal mortality rates, we've been able to get funds in the country, such as to do the PROMAC program. And so you can see the research in action actually helps to guide the policy decisions within the Ministry of Health. Opportunities we have published from here. These are our annual publications. So as the Dr. Ocho, I think, mentioned before, he was saying there's a difference with the academic writing and research writing, and I think it's a little bit of both. Sometimes it has to be combined, and that skill is needed for your strategic plans and your policies. But the publications have been able to bring about national changes. We've had to do several policy briefs, and of course, you build your portfolio through conferences, which I do intermittently. So that's it for now in terms of the policy research. There's one final point I want to make, and which I think I should have focused on a little bit more, but how do you feed your policy, your research from where you are? So you're a nursing student, you are an educator, you are a nurse researcher. How do you feed that data you have right up into policy for it to make a change at the policy level? There are several ways to do that. So publication is one, when you publish to a journal, but sometimes you publish to a journal, but it still has not made that impact locally. So you have to find the channels locally to feed your research up. And through some of these publications, one of those channels you have to look out for when you have your strategic plans and policies. Then you bring your research to the table and show where they make a difference so they can be fed into national documents. And I could go on and that, but I'll stop here for now and allow the others to continue. Thank you.
Thank you very much, Mrs. McFarlane. That was more than a mouthful. Now we move straight into Tamika. Duncan Baker, you're up.
Thank you so much. Good afternoon, colleagues, and a special thank you to Mrs. Cheryl Lloyd Garrix and her team for the invitation to share in this afternoon's panel discussion. Just bear with me a minute. I'm trying to move my slides. Okay, thank you for bearing with me. Research is an essential component in medicine or medical science. It is the only evidence-based method of deciding whether a new approach and it seems as if I'm having some internet issues because I can't get my slides to move, and it's okay. Are you seeing my screen now?
Yes,
Is anybody?
we're seeing the screen, yes. We're at nursing practice with special focus.
Still can't get it to move. Okay, let me start again. Sorry about that, colleagues. This is the thing with internet. You don't know when it's gonna act up. Okay, as I said before, research is an essential component in medicinal science. It is the only evidence-based method of deciding whether a new approach to treatment or care is better than the current standard. And it is essential to diagnose, treat, prevent, and cure diseases. It is also used to inform policies. Research nurses play a vital role in delivering research and is ultimately improves the patient care. And I must interject here to say that as before, nursing research, nurses' role is not known to be tedious and monotonous, as people have that concept. To me, it is complex, it's exciting, it's interesting, and it has a whole platform that still needs to be recognized and explored. So clinical research nursing. This is a nursing practice with a special focus on clinical research. It differs from care requirements for a patient coming into the healthcare setting for treatment of medical conditions. The patients we see are healthy clients. It requires appropriate skill sets and training. It requires a certification in good clinical practice, and the care is driven by research protocol requirements and the collection of research data. It requires coordination and provision of clinical care to research participants. It requires activities to support protocol, implementation, and research participants' protection. The assurance of maintenance of informed consent, integrity of protocol procedures, and accuracy of research data collection. And I'm going to look at 5 domains of clinical research nurse. The first is clinical practice. This is a provision of direct nursing care and support to participants in clinical research and their families. It determined by the scope of study participation, clinical condition of the participants, and the requirements and clinical effects of research procedures. So, study management. The management of clinical and research support activities in order to assure patient safety, address clinical needs, and assure protocol integrity and accurate data collection. Care coordination and continuity. Coordination of research and clinical activities to meet clinical needs, complete study requirements, and manage the linkage with referring and primary caregivers. Just to clarify this, it means that the research team, nurse, and doctors are not allowed to treat a participant, even though we may know and can diagnose whatever is happening to the person. We have to refer them back to a specialist or a clinic. Human subject protection. This is the facilitation of informed participation by diverse participants in clinical research. And that is to ensure that all the staff that are participating in the study, they're certified and trained in good, in GCP, which is a good clinical conduct, and also the protocol. 5, contribution as a research team member to the development of new ideas for study, exploration of innovations arising from clinical research findings to practice. Or roles and responsibilities of the clinical research nurse. This is advocating and ensuring patient safety and protection, keeping clients informed of study findings occurring during and after study termination, screening and recruiting and scheduling of visits, obtaining informed consent, adhering to good clinical practices. We are to be knowledgeable on the protocol requirements and ethical procedures governing the study. We're responsible for administering investigational products. We perform protocol-specific tasks, such as anthropometry, body scans, ECG, phlebotomy, collection of biospecimen, monitoring adverse effects and side effects, capturing pertinent data and maintaining accurate database on various electronic platforms, managing study documents and study finances. We also collaborate and liaise with the—
Not collaborate, we collaborate.
Sorry, collaborate with— Thank you. With all the members of research team locally and overseas. Qualification and experience. Being a research clinical nurse, we have to hold a degree of science in nursing. We also can hold a master's of science degree in the health field. We have to obtain experience working as a research nurse in clinical research. We are to obtain certification from 2 associates, either the Association of Clinical Research Professionals or the Society of Clinical Research Associates. We are encouraged to be members of the research association bodies, and we have to be proficient in Microsoft. Employment and opportunities. We, as clinical research nurses, we are able to work with government agencies, teaching hospitals, medical clinics, manufacturing companies, pharmaceutical companies, international health organization, private practice, or public foundations. And for concluding, I would just like to share a story on how I became a clinical nurse researcher. It was not intentional, it was by chance. I was invited to work at the university in the Faculty of Medical Science with Professor Minerva Thiem, and she introduced me to the field of research in 2007. It was interesting, but then I left and was employed by the Department of Care. Here, I conducted clinical trials, and I was so naive, I did not know that there was actually a specialist. Being a research nurse was a thing. So I was audited 2 years ago by the European Medicine Agency for one of the drugs that I worked on as a clinical trial. And when I introduced myself to the auditors, I said to them, I am the research nurse. And they took up my CV and they said to me, so where's your certification? I see here you have your certification in nursing, midwifery, and public health, but where is the certification for being a clinical research nurse? I said I was trained on the job. I didn't know that there was a specialty and I could enroll in a program. And that's when they shared with me the whole world international view on certification. And they really complimented my work, but with a little dissatisfaction in the sense that we were operating without being certified, or we did not have a clue about the roles and responsibility and job description in itself as a research nurse. And this is when I started to research and made myself certified, which I'm happy I did. So thank you for listening and thank you for having me.
Beautiful presentations again. We thank both presenters, and we are going to crave your indulgence and see if we can ask you for an additional 20 minutes as we move quickly into our next presentation, which will be done by Dr. Jacinth Lindo, who is an associate professor at the University of Central Florida, USA. She holds a Master's of Science degree in nursing education and a PhD in public health from the University of the West Indies. Dr. Lindo is passionate about building research capacity among nurses in the Caribbean and is known for creating collaborative, supportive learning environments, enabling nursing professionals to become successful scholars. Dr. Lindo has authored and co-authored 30 peer-reviewed articles and presented 73 abstracts at national and international conferences. Her research includes issues relating to nursing education, nursing practice, maternal and perinatal mortality, and workplace health. Dr. Lindo is a 2021-22 recipient of the Fulbright U.S. Scholar Program Award to the Bahamas. Her proposal includes teaching and conducting research at the University of the Bahamas and facilitating research method workshops in the Bahamas and St. Lucia as part of a project designed to build research capacity among nurses in the Caribbean. Please use your icons and let us make welcome Nursing Research in Action by Dr. Jacinth Lindo, Associate Professor of University of Central Florida. Dr. Jacinth.
All right. Good afternoon, everyone. Or is it evening? No, it's still afternoon. Thank you for your kind invitation and your generous introduction. And I'm so happy to be following Ms. Tamika Baker. Excellent job. And I love that you shared that you didn't know and because I could tell you the same story. The important thing is that there aren't enough mentors in Jamaica, and we don't have the exposure. So when you acquire the skill or learn something, it's so wonderful that you're sharing, and I really appreciated that. I enjoyed your presentation. So my topic today, I was asked to share my experience with respect to research, and so I entitled my thing "Building Research Capacity Among Nurses," and it's my personal experience. So today, I just want to maybe discuss the importance of research capacity building for the advancement of academia and nursing practice, and to share some of my experiences with research capacity building in graduate programs at USUN and at 2 universities in the USA. So I am quoting Professor Kawa on what is research capacity building. There are multiple terms that can be used: capacity development, capacity strengthening, capacity enhancement, and these are all used interchangeably. What is certain is that research capacity varies. However, the goals have shifted somewhat from just generating new knowledge, but to include knowledge translation. And so research capacity building is directed at enhancing skills of individual scientists and also strengthening institutional systems. And I think that the strengthening of the institutional systems portion is really, really important in Jamaica. So I know I'm preaching to the converted. Everybody knows that, nurses from the Caribbean are highly skilled. We're one of the most soughted group of nurses, but that we are challenged with research by the very thing that makes us strong, the fact that we have an apprenticeship model, a legacy of an apprenticeship model, so that we ought not to be embarrassed that we're not great researchers. We should, I believe, it's my perspective that we should embrace it and try to make ourselves better. So the lack of research capacity among nurses in low and middle income countries is commonplace and has implications for evidence-based practice. And Professor Kawa laid out the lack of publications, particularly among English-speaking Caribbean countries and so on. So I don't need to cover that again. So particularly on academic campuses, nursing faculty generally falls behind their peers because we're not publishing, and the standard for promotion is publication. Factors which have contributed to nurses' failure to reach their full scholarly potential include inadequate nursing research training and mentoring, low self-efficacy, negative attitude towards research. All have been described by our esteemed presenters today. So in my experience, when I taught at the University of the West Indies, I with a team of, should I say, we sought to strengthen research capacity among nursing faculty and students at both levels, undergraduate and graduate levels. And so we used action research to determine the attitude towards research among the students, and we developed a program of activities that we thought would create a more supportive environment. And this particular body of work is published in the Nurse Education Today journal. In summary, graduate students registered in a research methods course. They were exposed to a supportive learning environment with a minimum of 2 project supervisors. They were exposed to workshops. These were facilitated by experts outside of USON. And through focus group discussions, the students identified the quality of course leadership and faculty members' interest in the students and the students' welfare as enabling factors that reduced fears and improved the attitude towards research. And I know everybody heard Oscar describe that, Dr. Ochoa described that perfectly well. We found that among the students at USON as well. So recommendations from that particular study, recommendations from the participants studied included strengthening of research component during undergraduate training and consistency in research supervision. The fact is that we don't have an adequate number of mentors or research supervisors. And again, if we embrace it and try to develop some strategies to ensure that we are doing better at it, then I think that's the way to go. So from that class and with that project working on creating a more supportive environment, we were able to submit, I believe 21 of the 40 students submitted to the Faculty of Medical Sciences Annual Research Conference. And after peer review, 8 were accepted for oral presentations and 13 were accepted for poster presentations. And we went on to publish this 25% of all the papers of all of those projects. Several students published. So we believe that that was a good thing. I'm gonna move quickly because I know that we're out of time. Here are a list of some of the students who published. I know that you will know many of those names because they were your colleagues, or some of you are actually on the presentation tonight. So these are some of the journals that we published in, your colleagues. We were then assigned to teaching undergraduate students, and we used active learning for that process to engage undergraduate students in data collection and data analysis and so we worked with the students in a real research project. It is and was labor intensive. The students had a positive experience, and I actually believe that that's the way to go, is to introduce the students to this kind of research activity, which is non-threatening and it's conducted in groups, as you can see, and the students actually had a really, really good time in presenting the work. So at the end of, most people will know that 6 years ago I left Jamaica and went to take up a position in a PhD program at Barry University. I'm showing here my citation record, and all of these, majority of these publications, I'd done them while I was at the College of Nursing. Are you seeing are you able to see the link, or are you seeing the PowerPoint?
We're seeing the PowerPoint.
Oh, all right, good thing I showed the picture. All right, so let's go back to there. Okay, the link is not active. Thank you. So what I wanted to share here is that the majority of the presentations the most cited presentations are 2 papers that were done at USON. Factors that influence clinical learning experience of nursing students at a Caribbean School of Nursing, and satisfaction with nursing care in emergency departments at an urban hospital. You'll see that they've been cited 69 and 54 times in other peer-reviewed journals. So I think that's pretty good, and that we can be proud of ourselves here. So a little bit some reflections on the journey. When I got to Barry University, the department was a small unit, tiny unit, and a total of, we had like 6 people on the faculty. And when I got there, had the second most publications. so it's can be advantageous. You know, you'll be at a higher rank, you'll get more pay, and you know, definitely is the way to go. I wanted to highlight that when I got there also, it was that PhD program produces in excess of maybe 20 students per year. It's a real factory. I mean, lots of publications, lots of PhD students. So the faculty really weren't focused on publishing so much. They were focused on ensuring that the students were completing the PhD program. So that PhD program takes a total of 3 years, and the program is structured. It's not like our PhD program. There, I wrote this particular editorial that was published in the nursing research, and essentially it was an argument to promote student publications and the fact that you know, faculty should not be allowed to, it was my view that faculty should not be allowed to take first authorship of students' work, but that it is a way of ensuring that the student is publishing in a supportive environment, as Oscar described. Okay, I wanted to highlight in the article also the fact that policy is important. If there aren't supportive policies, then the students probably won't publish. We need to ensure that that's what's required of the students, and the institution should adopt those policies. The need for institutional support and interdisciplinary collaboration, those are helpful. So like I explained, I was at Barry in this PhD program, and it is a structured PhD program. Here is the, are you seeing, my screen is, are you seeing the PhD program plan?
Yes, we're seeing.
The PhD program plan.
Dr. Jacinth, we're seeing it, but probably if you put it in
yeah, no, it's in that on my computer.
all right.
See, it's on my second screen.
All right then.
Gotcha.
But we're seeing it.
I'm not sharing the right screen. One little minute. You're not sharing. See, you're supposed to be over here, screen 2. My apologies. All right, so now you're seeing the real thing. Okay.
Right.
So, yeah, the PhD program plan is structured. So in this particular model, this is a BSN to PhD doctoral part-time program. I want to make a few points. Big on philosophy. So I completed my PhD at UWI, not one philosophy course. And that to me was very important. So I have to tell you, just like Kamiko, at night I had to be reading philosophy left, right, and center because I had to teach stuff that I wasn't really so familiar with. And so it really was a learning experience, but I came away from that experience thinking that, you know, we do need a couple of philosophy courses in our program, a little bit, you know, more additional courses. It's not that it's not covered at all, it's that I'm suggesting like increased content. Okay. They also have 2 qualitative research methods courses and 2 quantitative courses. And then they have alternative paradigmatic inquiry, which assists us in helping to assimilate your philosophical perspective. And so it was a more comprehensive program, I believe. And because it was structured, it allowed for more success among the students. Students were highly likely to be successful. Unless your dog died or the cat ran away, you were generally successful. Okay, so the College of, I left I left Barry because they really weren't doing a lot of research. They weren't publishing that much. They really, it's a Catholic teaching university. And so I wanted to do a little bit more research. Moved to University of Central Florida, which is a Carnegie One institution, and they were doing more research there. And again, similarly, they had the structured PhD programs, which I won't go into. You can look at the link, but it ensures your success. Let me say that. University of Central Florida also had this life cycle framework that they put up in the library and all over the campus. And essentially, you can see on this framework the planning and the support from the very concept, from the conceptualization phase of your research project. So, there are teams of grant writing teams and so on assisting. And can I tell you that the librarian sits outside of my office? So within the College of Nursing, there is a librarian. These are some of the support structures that are going to ensure that you're more successful in terms of publishing. And even for the publication cycle, they support you. They'll try to help you to make sure your publication is disseminated adequately and try to give you great PR. So just in closing, two things I want to say. That undergraduate program, a few things I should say, because this is way more than two. The undergraduate program that we did at USUN, where the students did active learning and participated in the research process, that is the work that is being supported by the Fulbright Scholar Award. And so it's clearly has been deemed a positive way, or there's some value perhaps to looking at that as an approach. I want to encourage us to believe in ourselves, to avoid negative feedback. Not that you want to hear the negative feedback, but there's no point in getting negative feedback if it doesn't come with the alternative, or if it's not constructive. You didn't do this well, perhaps you could do it this way or that way. Because if that portion if it's not the sandwich technique, it's really not helpful, and it really demoralizes us and prevents us from going forward. And doing research requires you to have a positive attitude. You really have to be feeling good about yourself so you can think clearly. So if you are not maintaining a positive learning environment, that's going to be problematic. Publish. I really think you should encourage your students to publish. We do need more places to publish. I had a student complain recently that he was unable to get his papers published, but sometimes the topic that you covered or the subject area is limited and it doesn't really have a wide audience. And so our local publications, we really need to do a little bit better with that. And there are strategies we can discuss in terms of how we would do that. I, like Tamika, want to share that there are not enough mentors in Jamaica. And I encourage the PhD students or new graduates to pursue postdoctoral studies, because that's how you're going to learn how to do grant writing, and it's going to make your CV stronger that you were part of a grant writing process. That's something that's hindering me now because I didn't have that experience. So that's my little 2 cents. I want to thank you for inviting me. It was my pleasure to share with you. Thank you.
And it was our pleasure to have had you. So as we come down and we're requesting the additional time from you, we are going to move right in to the next aspect of our program, and that is at looking ahead. And just before we get there, we thank the 3 presenters. I know that they will be thanked officially. Denise McFarlane for looking at introducing us to the policies and telling us what is happening at PIOJ in Jamaica, the different policy researches. And the takeaway was, how do you feed your research up to the policy level? Tamika Duncan Baker spoke of the domains of the clinical research nurse and the roles and responsibility, and she went into how important the nurse was in that aspect. And one of the questions that a lot of questions came up, and I know that they will come up for Sherrod later, but then we went to Dr. Jacinth Lindo, and it was very interesting to hear about the structured approach to the doctorate, to the PhD program that they have. And I was just thinking how we could benchmark to make it much easier for our nurses and more interesting for nurses to want to be a part of nursing research. So as we look ahead, I will ask Mrs. Pauline Anderson Johnson and Mrs. Sandra Chisholm Ford to just go ahead and tell us what are we going to do as we move forward with nursing research. Just to say, Mrs. Anderson Johnson is the Development Committee Chair of Omega Kappa, and Sandra Chisholm Ford is the Research Committee Chair for the Nurses Association of Jamaica, and they are both lecturers at the University School of Nursing, Mona campus. So I ask that we welcome them. I know that you have your questions. We have been asking you to write down your questions, save them for the end. Cheryl will be coming to take your questions, but let us look at the way forward as we continue with this afternoon's feast. Sandra and Pauline.
Okay, good afternoon, everyone, and thank you. Can I be allowed to share screen? I have 2 slides, please.
Madam President, I think maybe your screen is up, sharing, or I'm not sure who this is. It needs to come down to allow her to share.
Justin, you can stop, yeah.
Gotcha.
I wasn't sure. Okay, thank you. Okay, thank you, everyone. And wow, what a team we have had so far. Yes, so much so, and I hope we will have enough time for discussions. I'm not going to spend long at all. As the research committee chair for Omega Kappa, these are some of the things that we are mandated to do, you know, to oversee the process of developing, reviewing, and revising the criteria for research awards, and for funding grants, to manage the process of reviewing and evaluating abstracts, to oversee the planning of chapter research conferences, and the development of strategies for promoting the conduct of research. And having heard all the things we've heard, we've seen that we've had the experiences, some of them are negative, some positive experiences. We've seen the history throughout the Caribbean, Jamaica, our School of Nursing. And now we are also talking, not just research, but we're talking about evidence-based practice. So where do we go from here? And as I said, I'm not going to repeat some of the things. We have heard a lot from all of our presenters, but some of the suggestions we are looking forward to in Omega Kappa is to have our doctoral level nurses and candidates to form a part of the core network or team for research development at UWISON and in Jamaica and the Caribbean. Collaboration would be key. So as we are doing today, collaborating with the Nurses Association of Jamaica, now we are having some of the members being members of Omega Kappa as well. So that will make it easier. We're collaborating with the Ministry of Health, other Caribbean countries, other universities, and of course, other Sigma chapters, including the chapter that we have dual membership with, and to continue our webinar series on different aspects of research. Now, I want to present this aspect. I mean, a lot, Cheryl and a lot of our colleagues, you've heard me talk about the veranda conversations. And I think this is a way to go where
we can make this a little bit more formal. While it is an informal way of gathering, we can ensure that our objectives are formalized, and the way we go about discussing research, developing our projects, proposals, articles for publications are so. I mean, I had listed 5 areas that we would need to make sure happen while we have these conversations. So we would have, of course, say we want to do a project or we want to publish an article. We'll have clear objectives, of course. We'll have, each time we meet, we should have a leader or a moderator, and we need to have experts within this small group that we have. We can even invite others. So while others may not be able to join physically, we can invite others virtually while we're having these discussions. It's important, I thought, that we listen to each other and we write, because it's a learning process as well as it will be an action process. And we should set up a reasonable time frame, you know, clearly stated outcomes which are feasible, and we should encourage, and some of our presenters mentioned this, encourage our positive attitude, encourage each other in going forward and not giving up in each. I am thinking that sometimes we can not just the lecturers and clinicians, but include our students, include our graduate students, include undergraduate students who are interested in research as well. And of course, we need to encourage and celebrate the process. And so Omega Kappa, we are planning 2 things to fund research. And as you see, it may not be a lot, but every mickle makes a muckle. And while we may just be able to fund one small area, but that is one of our plans to fund research, and all the process and everything has been developed already. And also to award persons. So we are planning for a research conference to ensure that we have awards for students awards and our nurses awards for poster presentations to start with. And we hope in the near future, or as we, you know, develop our financial base, that we'll be able to do more than one award for each time. These, I mean, we will continue with our discussions in going forward. I'm sure that other persons have more ideas and we welcome them. Thank you so much. Thank you.
Sandra, over to you. Is Sandra still with us? Are you seeing Sandra, Cheryl?
Madam President, this is Melissa Walker. I'm not seeing her name.
She's there. She's here. She's here.
I'm here. Are you hearing me, seeing me, colleagues?
Yes.
Awesome. Hi, Dr. Linda. Okay, colleagues, it's also awesome to present last, because when you present at the end of a presentation that follows all these brilliant scholars, you don't have a lot to say. But thank you again, colleagues, for inviting me. And I must say, I am a member of the Omega Kappa chapter of Sigma and a member of the Nurses Association of Jamaica, and we are collaborating to promote nursing research in Jamaica. I don't have a lot to say. Pauline just said that, but she said a lot, but I promise you, I don't have a lot to say.
Sandy, I think you may need to turn your camera off. You're breaking up.
Well, on its way, we have just, yes? Oh,
Sandro? Sandro?
She seems to be having some interconnectivity
Yes, it says
challenges.
our bandwidth is low. Sandra, are you hearing us?
Her mic is actually, she's actually off. She's actually, she actually fell off. So in the meanwhile, until we get back, Sandra.
are you hearing me?
We are hearing you now, but we were not hearing you just now.
Well, I'm sorry, my provider is not the best, and it's flowing like molasses.
All right, so you could go ahead now.
Colleagues, let me share my screen and I will present briefly.
I was suggesting, Sandy, you could turn your camera off to
I shall.
save the
I shall.
bandwidth.
Thank you. Thank you. Okay. Are you seeing my slide?
We're seeing, but you need to put in slide. Okay, there you go.
Okay. Okay, I'm sorry. Let me go again. I was just presenting that the Nurses Association of Jamaica, we are pledged to strengthen our research presence in Jamaica, and we have embarked on this project that has been in the pipeline for quite some time. We have really put a lot of effort into getting it to this point, and I must say that we have gotten approval from the Ministry of Health and Wellness after much struggles, and my colleague Dr. Ocho did speak to that as one of the issues related to nursing research in Jamaica, the challenges in receiving ethical approval. So we have received approval from the Mona Campus Ethics, Research Ethics Committee, as well as the Advisory Panel on Ethics and Medical Legal Affairs in the Ministry of Health. So we are awaiting permission from the various regions to start our data collection, and we are hoping that by year's end, this project will be completed and on its way to publication. The other project that we have is the Knowledge, Attitude, and Practice project that is just in its fledgling stage, and we are just preparing the proposal for ethical approval. We are planning on collaborating with the Omega Kappa chapter again to, I'm sorry, I'm getting feedback that my internet is unstable. Sorry about that. That we will be launching a webinar series or a research webinar series for August 2021 with a series of topics. And these are just some of the topics that we're going to be looking at, and we're planning on ensuring that the topics covered will look at research from the conception, the thought of a topic to its publication and dissemination. We will also be collaborating with the U.S. School of Mona to conduct a study on the migration and its effects on nursing in the Caribbean. And this will be done through the PAHO WHO Collaborating Center at the School of Nursing, Mona. And of course, dissemination of research is very, very critical. It makes no sense you do your research and publish without persons knowing that this study is actually somewhere out there. So we will be reviving the Jamaican Nurse, the original magazine of the Nurses Association of Jamaica, and members will be presenting at various conferences locally, regionally, and internationally. And to begin, a team of 4 members of the association will be presenting at the ICN conference to be held later this year. It should have been held in Dubai. However, due to COVID, we will be presenting virtually. So the Nurses Association of Jamaica will be represented in that forum. And this is just some of the things that the association has in up our sleeves at this moment. We have been struggling with getting our foot wet with research for quite some time. So we will be taking it slowly, biting small bits at a time so that we can make our presence felt locally, regionally, and internationally. Thank you very much.
Thank you very much, Sandra and Pauline. Very enlightening. And the future of nursing as it relates to nursing research does look bright. I will hand over now to Cheryl, who will open the floor. We don't have a lot of time, but we will take a few questions. I don't know if you have any, Cheryl, if you've gotten any in the chat.
Thank you so much, Madam President. I will double check in the chat. I was asking persons to go ahead and type them in the chat, but I think it was mostly comments so far on what they've been hearing. So colleagues, let us apologize for the fact that we've gone over the time we said we wanted. So while we were just listening, I said, in true spirit of nursing, please, I created a nursing diagnosis, right? Extended panel discussion related to an important, extensive, and necessary topic manifested by a request to extend the time of the session and the agreement of the panelists and the participants. So we just want to thank you for staying with us. And as we are closing out, would you like me to lobby to have that in the NANDA? Yes, I shall. So we thank our panelists for staying, and we thank those who are here with us as well. We are asking you if there are any burning questions to raise your hands quickly. Let us know who you're asking in particular. If you're not sure you want to raise your hand, then go right ahead and type it in the chat quickly so that we could go ahead, and I will acknowledge Mr. Croker. Go right ahead with your question.
Okay.
Desmond? Yes.
Yes. I want to say thanks to all the presenters. The information shared was very interesting. As I would have mentioned to you, Cheryl, this is something I'm looking forward to. My concern is with regards to the publishing of the information. I have seen in the chat where at least one participant did indicate that challenge. I am one of those persons as well. I'm sure there are others that have information that we would have researched. I would have done extensive work on diabetes self-management and gained information to share. But where do we go from here? Can we, is there anything that Omega Kappa is planning, or the Nurses Association, where we can get the kind of skills that we need to move on from after completing the research to publishing the research?
All right, thank you, Desmond. So that was a general question. And if I may, just from what Mrs. Chisholm Ford said just now, one of the first things we're hoping to embark on is a workshop series. We hope to start in August. We hope we may have the time and the resources to facilitate looking at, from the beginning, picking a research topic, going right ahead into preparing and conducting the study, and closing off with dissemination and publication. And then from Omega Kappa as well, I know our development Research Development Committee will be also looking at ways in which we can build that capacity in our membership so that we can have them share it with wherever they are as well. I think
may
Oscar
I-
also wants to answer.
May
So I saw
I,
Oscar's hand.
may I, Cheryl, after
Yes, go ahead.
Oscar?
All right, no problem.
In response to that question.
Okay, all right. Go ahead, Oscar.
Yes, thanks for that question, Desmond. I think there is an underlying assumption in your question that what would have been researched would have met the criteria for good research. The challenge very often, and the reason why it's difficult to get into high quality and research journals, is because very often the project itself did not meet the basic standards of methodological rigor. So before we think about publication, we cannot wait until we have completed the research to think about the publication. Publication has to be integrately entwined into the development of the project itself, because if it's not robust, you will get nowhere. And the other critical thing I want to say is one of the challenges we face as Caribbean people. We want to kill the bear, but we want other people to help us kill the bear, but they must not get the credit for supporting us in killing the bear. So one has to recognize that sometimes you just have to learn to build linkages with others who could provide the support so that they now share in your credit. So it's not just you, but it is we. That's something that we have to develop some more as a region. Thanks.
Yes, I agree, and I have no problems with that at all. That I'm willing to work with that.
Thank you so much, Oscar. Madam President, you said you wanted to also respond?
Yeah, just to say that we do produce the Jamaica Nurse Journal, and one of the discussions going forward coming out of not just the research committee, but also the journal committee, is that we want to have one of those journals. We want to produce 2 journals per year, but we want to have one being strictly scientific. And with that, we want to get what Dr. Carver spoke about as being the impact factor, with where we can get it reviewed, having the peer reviews and all of that. So that is something that we're trying to embark on, to have a scientific volume and then another volume which speaks to the activities of the association. So the association is and has been making calls for abstracts and for research papers. So persons who have their research, once is it up to publication, as Dr. Ocho has said, then we will be willing to publish.
All right, thank you so much, Madam President. All right, I have a question in the chat while we're thinking if anybody else is raising their hands. How can nurses at various hospital and community levels be more involved in research? Will there be a request from, sorry about that, another question popped in right while I was reading. Will there be a request from NAJ or otherwise for an interested representative to meet with the research team to build their capacity? All right, so they're asking how can we involve the nurses at the hospital and community levels? And are we open to having nurses who are interested meet with the research team to build their capacity? I would suggest, Justin, go ahead if you have a response for that.
I wanted to respond to the question of the publication and as well as the current question. I think the rejection rate from journals is like something like 80 or 90%, if I'm not mistaken. So it is not uncommon for publications to be, for your papers to be rejected. And you shouldn't be disheartened, because sometimes it's just not the right place. I agree with Oscar that, you know, you need to carefully consider where you will publish the paper on completion. Notwithstanding, I mean, we are not really funded, and we tend to primarily do descriptive studies. And maybe the statistics aren't as advanced as they would like them to be. But I want to submit to you all, ladies and gentlemen, that half a loaf is better than none. So that even though your study might not be strong enough to make it into the ISCN journal, which has a high, the Nurse Educator, or, you know, but your study would be relevant to Jamaicans. And so the Jamaican Nurse or the Caribbean Journal of Nursing would probably make a good home. And it's the same thing for the West Indian Journal of Medicine. And none of those publications are publishing in a way that produces a volume regularly or frequently, or, you know, and people would be hard, particularly academics, would be hard pressed to submit their papers to the journals that with those impact factors, because those things they affect whether or not you will be promoted. So I believe that we have to be supportive of our peers, and that the publication, it has value. It's telling us something about Jamaica, and maybe the science is not the highest level. It's probably at, you know, lower level on the evidence table. But I think that there is value in much of the work that is produced, particularly in the universities. University of the West Indies, I have to tell you, I won't talk long, but what we are requiring our master students to do, believe me, my weakest student in Jamaica would do very, very well in the US, because the USON program that I am experienced with is far, far more challenging, and it doesn't provide the level of support that the North American institutions provide in terms of ensuring that the student is successful and so on. With respect to the institutions participating with research, I believe that it's up to the academics to reach out to the institutions, or vice versa, to have that kind of collaborative engagement. And there are models, Johns Hopkins model, and there are several models that show us how to do that. Thank you.
Thank you so much, Dr. Lindo. We have a question for Mrs. Duncan Baker. The question says, based on her experience as a clinical nurse researcher, oh, this is moving so quickly, my computer is not cooperating. All right, I just want to make sure I have it.
That this position be accounted for on the nursing level at the Ministry of Health.
Thank you so much, Madam President. Tamika, are you still with us?
Yes, I'm with you. Thank you for that question. But I highly recommend that clinical research nurse be part of the nursing specialty or a program in the nursing education system. And being so because clinical trial is what is pushing forward. Research has evolved, and clinical trials are now the gold standards. And we need it because even healthcare has evolved. And we can see this from the pandemic. And nurses play a vital role in providing the data and to ensure the protection and rights of clients. On the surface of research, we are silent, but we are doing such an amazing job without recognition. And if it wasn't for the nursing corps, I mean, we wouldn't have such good quality data out there. So I think we should get on board, because the world is gone and we're still behind, because from the audit that I'm participating and the research that I did for myself, I realized that we have a place out there and we're in high demand, but we don't know. Because even with joining the associations and I see where they have a platform and they have their job descriptions set aside, and they also have their salary package. They also have opportunities that you can launch into as a clinical nurse researcher. So I think we should sensitize our student nurses and also spread the awareness that we do exist, and research clinical nurse is a thing, and we are very vital and important to the industry of research. So I do agree. I do agree.
Thank you so much, Mrs. Duncan Baker. So now we're putting a little bit more work in your hands. You are a part of both of these organizations today. We're gonna have to work on a plan and put it out there so more of our colleagues who may be interested in this can become a part of it, along with those colleagues you have working with you, and the process involved in, for instance, being certified while you're here. So we will be dialoguing some more as we look at working towards the workshop series coming up. So thank you so much.
And Madam President, Gary Floyd, just to also say that I am so passionate about my area, because it's a thing now, that they also empower the nurses to become principal investigators and also do research of their own. So you will have sponsors seeking out nurses to conduct research. So we don't have to wait on doctors or other big organizations. They do encourage and promote us.
All right.
Yeah.
Thank you so much, Mrs. Duncan Baker. So we have some work to do. All right, colleagues, we have spent the time and we've been happy to be with each other. You know what I realized? The president and I were saying, boy, we needed a part 2 for this conversation because one part would not do. But we're just double checking. Are there any final questions before? I just wanted to ask each of our panelists to just give me at least one recommendation that's most burning to them on how we can move forward to advance, promote, and facilitate nursing research. And I think I'd like to start with Prof. Kawa, if she's still here.
Yes, Mrs. Garrick Lloyd, I'm here. Well, thank you for the opportunity, and I'm really glad that I have been able to participate. And of course, having been through the same process, you know, the process of being a student and, you know, a nurse and a student and, you know, teaching at the university. I mean, there are, the one thing that I would like all of us to, if we want to do research, at least something that I know helped me up to this day, it has to start with our own attitudes, okay? Our own, I mean, it really takes our self-motivation to get through all those issues that we know. Research is a long, tiresome back and forth process. It is, and anybody who has done research knows that, but it takes time. Unless you are self-motivated, it becomes really, really hard. So I think that is one thing to, I mean, giving up, unless you are self-motivated, giving up is very easy. The one thing that I know got me through is self-motivation. Even when, I mean, I can tell you as a student, I remember having gone to my supervisor's office and he slammed the door in my face, basically, okay? But guess what? By the time I went back to him, I had my proposal done. I never went back, okay? I had it.
Prof. Kawa.
Okay, so it needs to start with you, because unless you are motivated to overcome the challenges, it becomes a big problem. There's, of course, there are so many other components, but that is one thing.
Self-motivation.
Your self-motivation.
All right, thank you, Prof. Kawa. Mrs. Parsons-McIntyre, what's your one recommendation?
All right, I do believe that what we ought to do is to put research out there. So in every workshop, every seminar that we have, we ensure that we are sharing a study that has been done. You know, our nurses ought to be seen, the individuals. Here we have Mrs. McFarlane and all the others, who, all of you, you know, who are conducting these research studies. Make it known, let it be seen that research is happening. So every opportunity we get in our seminars, in our workshops, by our association or wherever it is, research should be highlighted.
All right, thank you. Dr. Ocho, what's your one recommendation?
I think it's time that we stop talking as a Caribbean people. We are
All
very
right.
good at that. And we start looking at building research projects that have regional impacts.
We're not hearing you as clearly.
No, I said, I said it's time that we stop talking, because we are very good at talking as Caribbean people, and we start building research projects that have regional impact. So let us work together.
All right, thank you, Dr. Ocho. I hear you, Mrs. McFarlane. You have your one recommendation ready?
Yes, thank you. I think have been listening to what I want to talk about is the team approach. I think this individually we've done quite a lot of work, but especially in the grant writing area that Dr. Linda mentioned, if you're going up for a grant, and sometimes a very large grant, they expect a team. So we too as nurses need to begin to look in how to building research teams, strong teams across. It could be 5 of us right here on this panel to submit grant proposal, to do larger research and have that regional impact that Dr. Ocho is talking about. Hardly likely that one person is able to hit that nail so hard. So it's a team approach and building larger research teams. That's my recommendation.
All right, thank you. Mrs. Duncan Baker, any one thing you think you'd like to recommend to us to advance, promote, and facilitate nursing research?
Yes, by sensitizing student nurses about the specialty of clinical nurse, research nurse, because nursing does not have, research does not have to be all just monotonous and paperwork. There are different avenues of how to conduct research or become involved in research using the nursing skills that we have acquired in our training to advance health, and also for heightening the awareness through programs like these. Thank you.
All right, thank you so much. Dr. Lindo?
Oh, I just want to congratulate you and your team for a fantastic event. I really enjoyed it, and I think more events like these will definitely help to shape attitudes and encourage persons to participate in the research process.
All right, thank you so much, Dr. Lindo. Mrs. Anderson-Johnson, Mrs. Chisholm-Ford, did you have one recommendation for us?
Pauline here. So I too want to recommend the team approach and the informal conversations that we'll have that will help us to clarify and build. That's very important.
All right, thank you. And Mrs. Chisholm-Ford?
Thank you, Mrs. Garrett-Lloyd. My comment is, and my recommendation is the utilization of research assistants. I do believe I will breach that conversation with my president
of research
as it relates to having a research assistant.
Okay. All right.
You know, when Dr. Linda spoke about having that person sitting at her, getting publications done, getting manuscripts written and so on, we need that level of support so that we can get our research out there.
All right, so thank you so much, colleagues. I will leave the closing remarks for Mrs. Edwards-Henry, and she could maybe include her one recommendation, but let me just sum up what we've had. Let me start off by saying thank you all so much for staying with us, for actively participating, and for listening. I want to really thank each and every one of our presenters tonight. We thought of this, and I have to tell you personally, I'm happy with the way our conversation went tonight, because really what we want, I'd agree with Dr. Ocho, is for more action, but maybe these sessions, as was given, will help us to get the conversations at the point where we're actioning and not just talking. So if I have it correct, we need to start with self-motivation. We need to start moving into action and not just talking. We need to have more of research being shared in all the sessions we're able to, especially among nurses and nursing. We should look at the team approach. We want to start with sensitization for our nursing students. I would dare to add undergrad and postgrad, and more events like these. And I think Mrs. Chisholm-Ford said, having somebody to assist you. I'd also like to add, my recommendation is that we have these conversations and include what it will look like, how it could look, and not just from the student's point of view, because for a lot of us here, doing research as students was more about meeting the deadlines. Now we want to have research as a part of what we do in our jobs, no matter where we are working. So I think we need to consider that as well. And I'm hoping that we'll be able to have the participation of everyone here in the collaboration to facilitate our workshop looking into August, to ensure that we are advancing, promoting, and facilitating nursing research capacity. I'll hand over to Mrs. Edwards-Henry for the closing remarks.
Thank you. And all that's left for me to do is say thank you to all the participants, the presenters. We had a good evening. I do hope that as we have started this conversation, that we can continue, that as the professionals that we are, we can see research spilling over into our everyday lives, our actions, or at our jobs, wherever we are as the professional nurse. We will talk and we will walk and we will just have research, and evidence-based practice is the hallmark. Let that be the hallmark of the professional nurse. Thank you all for starting and staying the course with us. And as President Cheryl has said, we look forward to the next part where we will continue this conversation. God bless you. Those who are traveling home, travel safely. Those who are at home, remember, stay safe.
Thank you.
Thank you so much. Have a good evening, everyone. Thank you, Mrs.
Thank you,
Murphy-Nedrick.
everyone.
Thank you, everyone. Good night.
Bye,
Good night.
everybody.
Good night. Dr. Monroe would say, let me hear all the noise and the chaos of the buys. Bye.
Bye. Have a good night.
Bye.
Bye, Jasmine.
Bye.
Everyone too.
Bye.
Bye.